is the plan to cut Medicare. I mean, the new bill goes a step further. The way I read it, and I indicated the sections in the bill just a moment ago, we're not going to cut Medicare, we're going to tax Medicare. And then we're not even going to spend the money on Medicare. In other words, we're going to cut grandma's Medicare, tax grandma's Medicare, and spend grandma's money on somebody else when grandma's Medicare is going broke in 3 or 4 years, according to the Medicare trustees.
And in addition to that, we're going to continue to tax young people who are in the workplace for additional Medicare taxes that is intended to be used by them in what's called the Class Act. That's another part of this monstrous bill, and chances are those people are never going to see those benefits. There's just one tax after another that's in this bill that applies to Medicare. One other aspect of Medicare that is such critical importance here is that they've got an $850 billion price tag, according to the Democrats. According to the numbers and the figures that Senator Gregg, the ranking member of the Budget, is that $850 billion is for the first 10 years. The taxes begin next year. The benefits don't begin until 2014. When you look at 2014 to 2025, the first 10 years of full implementation, the cost of this bill is actually $2.5 trillion, not $849 billion. And why is it $2.5 trillion? Well, it is because the scope of government is broadened to such an extent that the expense of providing the services is going to be greater. We're going to have more people coming onto Medicare. We know now, as Senator Alexander just said, according to the Bipartisan Medicare Commission, that we'll be paying out more in Medicare benefits than we receive in Medicare taxes in the year 2017. There are only two ways to fix that. You either raise taxes or you decrease benefits. Now, the majority that's in power in Congress today has a habit of not seeing a tax they don't love, so my guess is that's the direction in which they're going to want to go. Raise taxes on Medicare beneficiaries and those in the workplace again to ultimately pay for Medicare benefits down the road. The other part of this that I want to address with respect to Medicare is the senator from Florida just got up as we were coming onto the floor and talked about this so-called deficit reduction. And what do they mean when they say we're going to have a $32 billion deficit reduction over 10 years? Well, here's how it works. The deficit reduction is brought about primarily by the addition of a program in this bill to Medicare of what's called the Class Act. The Class Act is a long-term policy of insurance to take care of long-term health care needs. Young people are going to be required, young people in the 20, 30, 40-year age bracket will pay into the so-called Medicare trust fund that will be used to pay benefits for long-term care for those individuals when they start reaching the age where they need long-term care. So CBO has said that because these folks are 20, 30, and 40 years old and they're going to be buying these policies, they're not going to be getting any benefits for another 20, 30, or 40 years. So we're going to take the position that all of those premiums, which go into the general fund by coincidence, will go to reduce the deficit. But guess what's going to happen, even according to CBO? When all of these young people who have been paying into the Class Act start getting benefits, all of a sudden, you're going to start seeing deficits in the out years, and our children and our grandchildren are going to have an additional debt put on them because of the way that this particular provision is scored and it being touted as a deficit-reducing provision right now that truly is going to be a provision that adds to the deficit and the debt that our children and grandchildren are going to have to pay.
I wonder if I could say to the senator from Georgia, while he's been speaking, the senior Republican on the Joint Economic Committee has come to the floor, the senator from Kansas. You've heard Senator Chambliss talk about these projections. It must be a little confusing to the American people. I mean, on one day, Senator Reid comes out and with a big hurrah, we're going to reduce the deficit, and then we're only going to spend $800 billion. And then the next day, Republicans come out and say, nope, when the program gets going, it's $2.5 trillion over 10 years. How do you explain this to people in Kansas, Senator Brownback, who must be very confused by this back and forth?
Well, I don't think they're particularly confused. I think what they do is they smell a rat in this, and they know that if you're going to add this big of a program, somebody's going to tax me somewhere here. And the interesting way that this is actually scored in the bill is the government uses the old heavy hand of inflation. And as you've heard many economists talk in the past about, inflation is the most cruel tax of all, particularly to people on fixed income, because then the base of the dollars that they have just don't go as far as they used to. And what's scored in this bill, and we've seen this time and time again, is what you have is an inflation factor. It is not indexed. It is not indexed. And I want to show you these charts here to just prove it. And at the end of how this is scored, you end up having people that have subsidized insurance when they start out, that in the out years in the scoring will be taxed for having subsidized insurance. So we'll be both taxing them at the same time as we're subsidizing their insurance. We're also, and I'll show a chart here in just a minute, where we're going to be taxing their insurance plan that we're subsidizing at the same time, and that's built into the base score. So then that's how you get to a CBO score that presto changeo. We don't have any, the budget is balanced, we're even producing a surplus. And it's this cruelty of inflation. And if people can remember back to the Jimmy Carter days of 10% inflation, they know what that did to them. Look at these, and this is all in the CBO scoring, and this is from Joint Economic Committee staff. We've been working through these calculations to see how do you come up with adding a multi-trillion-dollar entitlement program and come to a budget deficit neutral facet to it. And what you see here is surtax levels on this top. It's kind of a busy chart. This red chart is 100% of poverty in 2009 and 100% of poverty building it out in 100 years, which is also, this is part of the scoring system, and then the median income of married household. And what you see is families receiving subsidies begin to pay the surtax in the scoring of this. And that's all due to the cruelty of inflation. The cruelty of inflation.
Ask the senator from Kansas, haven't we heard this story somewhere before? As I remember back in the late 60s, there was a so-called millionaire's tax. We were going after 155 really rich people in America who weren't paying any taxes. Now we call it the alternative minimum tax, and if we don't fix it every year, I think last year there were 28 million Americans who would have had to pay the tax.
That is absolutely correct, and it's the same technique. This is the alternative minimum tax on steroids in the insurance industry and in the insurance field. Same thing. And we fix it every year, and that's why this is such a fraud. Because do you really think we're going to tax people for their health insurance at the same time we're subsidizing their purchase of health insurance? No, that isn't going to happen. So those dollars aren't going to arrive. And so where are those dollars going to come from? It'll be from deficit and debt, or you're going to have this cruelty of inflation taking place. Bill funds health care reform with increased Medicare taxes. You're going to see that taking place in this as well. And here's the one I really like that I wanted to show is that how we're going to have these Chevrolet plans. You've heard in health insurance in this. Let me put this chart up for you about, okay, we're just going to tax the Cadillac plans, all right? What turns out under this bill, the Chevy becomes a Cadillac. And so you're going to tax the Cadillac when it's still a Chevy. That's because of inflation. Most people know that their health insurance premiums have been going up pretty consistently over time. Well, it turns out that Chevy metamorphoses into a Cadillac and it gets taxed, and that's in the scoring of the CBO scoring of this bill, and that's how you come out with balancing the cost of the bill. Well, none of this is going to happen. You'll have some sort of AMT type fix that'll take place on an annual basis. And at the end of the day, you get a big debt and deficit that you're going to have with it, or horribly cruel high levels of inflation, or maybe both.
I would ask the senator from Kansas Fidel for a question, and the question, Mr. President, is you and I were elected to Congress in the same year. This is our 15th year, I believe, of serving. You've been over here longer than any of us have, and also you involved in state government. Have you ever seen a federal program that was projected to be at X number of dollars of expenditure and that it come in on time and on budget?
No, I haven't seen that take place.
Do you really think that when Senator Reid comes down here and says this bill is going to cost $849 billion over 10 years, that that's a correct figure for a massive reform of health care?
No, and I don't know that there would be 5% of the public in my state that would believe that, because their experience tells them different. Their experience tells them, look, I know you guys make these great promises and everything, but I also know the further out you make this promise, the less reliable your data is. And what I've seen, whenever the government gets into things, it always costs a lot more, and it seems like our debt and deficit always keeps growing, and it is way too big. Now, what is troubling is that this is built into the base of how we get to the numbers of getting this as a budget neutral matter. This isn't going to happen. And on top of all that, you're going to say they're going to save $400 billion in Medicare. We've now voted 4 times for the so-called doctor fix, which was a slight reduction in Medicare spending for providers, and I voted for it 3 times to fix it on an annual basis. Do you possibly think that the Congress is going to cut Medicare $400 billion? That people are going to come back in and say, you can't do that, you're going to be ruining Medicare, and the Congress will fix it? I was saying this to Secretary Geithner yesterday, Treasury Secretary. Our experience has never been to do something like that. So then where does this money go? It goes right on the deficit and the debt. And you're going to add to that $12 trillion at the same time we are hemorrhaging federal money, at the same time the global community is saying, you got to get your fiscal house in order. We just had a president over in China, hat in hand with our bankers, saying, you know, okay, we think human rights is pretty important, but we really need that loan. What you're going to see take place, because this is a fiscally irresponsible package, I think you're going to see the international community saying words are one thing, but actions what talk. And we're going to start pulling capital out of the U.S. marketplace. It's going to drive interest rates up. It's going to drive inflation up. So maybe this scenario happens, but it's going to be cruelly done through inflation, and it's not fair to the American public.
I wonder if I might ask Senator Isaacson from Georgia. He talked about his experience as a small businessman. Senator Brownback's talked about taxes and how they're going to go up. According to the Republican Budget Committee analysis, the new taxes in this bill that were on our desk would be about $850 billion over a 10-year period of time. Now, Senator Isaacson, you've been a small business person. Some of those taxes would be on you. Who's going to pay the taxes?
My customer. You know, the thing, business is the collector of taxes for the government. The government imposes a fee, a fine, a cost to business, and it rolls into the base of what that business has to pay to produce its product, and it's upon that which they make a profit. So this business that they're taxing business, they're just getting business to collect a tax from the ultimate consumer. That's all it is. And I want to throw something else in. I appreciate very much Senator Brownback. You know, Senator Brownback, I was in Georgia a few weeks ago, in Albany, Georgia, near where Senator Chambliss raised his family. And I was speaking to a Rotary Club and was asked by a fellow out in the club. He said, you know, you keep talking about $1 trillion. How much is that? And I babbled and I fumbled, and you know, I really couldn't. Have you ever tried to quantify that and explain it? It's a huge number. We're talking about $2.5 trillion here in that first full 10 years. So I got so frustrated, I went home and got on my calculator to try and figure out some analogy as to how much $1 trillion is. And I finally decided, well, I wonder how many years would go by for 1 trillion seconds to pass. I got on the calculator, I worked it out, and you know how long it was? 31,709 years for 1 trillion seconds to go by. That gives you some proportion of the volume of dollars that we're talking about in taxes and in cost, and as you said so rightly, in debt. That, sir, Senator from Tennessee, is a lot of money, and the American taxpayer ultimately is on the bill for every dime of it.
Let me ask my colleague from Georgia. We've talked about this, and I know you, as I said earlier, you've had extensive experience at the state level, but with respect to Medicaid, let's take our state, and we're pretty representative, I think, of all 50 states. We have a Medicaid program now that provides for coverage or eligibility at 100% of the poverty level. This bill takes that to 133% of the poverty level. Talk for a minute about the impact of going from 100 to 133% to cover some of those uninsured that I referred to earlier. What's the impact on our state?
Well, right now in the state of Georgia's current year budget, the cost of Medicaid is $2,150 million, about 12% of state appropriations. This bill, as it's currently configured, raises eligibility by 33%, but the feds hold harmless the states for the first 3 years of that increase, and then it's a 90-10 split for the next 3 years, and then it's silent. So let's give everybody the benefit of the doubt and say the states only have to pay 10% more. That's $250 million more in Georgia. You go from $2.15 billion to $2.4 billion in a state budget that's compressed, and then, quite frankly, we all know what ultimately is going to happen is what happened with the first Medicaid. And that is the state's going to have to pay the full 35%, which would mean over time, at the end of that 10 years, using today's numbers without inflation, Medicaid cost in Georgia for about 12% of the population would go from $2.15 billion to $3.4 billion a year for Medicaid.
And whether it's paid by the federal government after that 3 years or whether it's paid by the state of Georgia, whose pockets are going to come out?
It's coming out of the taxpayer's pocket of the United States of America.
Yeah.
Or as we were discussing earlier, Senator Brown, back before we came, it could be paid by out of the pockets of the 18 or 20 million students who go to the University of Kansas, Kansas State. We began this discussion by pointing out that California raised tuition yesterday 32% for its students. And they're all pointing fingers at each other, but they should be pointing at us for not reining in Medicaid, because over time, that's the biggest reason why.
If I could interject here, in my state of Kansas, a huge budget debate going on right now about where we're going to come up with the shortfall this year in the state budget. And a number of people are saying, well, okay, you've got some places, but you've got to do this on Medicaid. So it ends up, in all probability, a disproportionate share coming out of the schools and for the school children. And is that what we at the federal level want to see taking place? Well, no, and that's one of the reasons I'm voting against this bill, is you are dictating a state budget, and initially the feds are putting in the full amount, but I've seen these start before too, and you start with the federal government wiggling, the carrot, okay, come on, take a bite, you can do it, and then once you get hooked on it, and they start going, okay, now we're going to reel it in. And you're going to start paying more of it, and it'll be the federal government dictating in the state budget, taking it, putting it in Medicaid, and taking it away from schools. That's what's going to end up taking place. That's what's happening in my state now. And it is not fair to do that, and it's not right for us to do that. And most of the people across Kansas think this whole thing is fiscal insanity. Literally fiscal insanity of what we're looking at doing with that level of debt, $12 trillion here, with my state having this level of debt that it has, with making this this multi-trillion-dollar entitlement expansion when the federal government is hemorrhaging money as well as state governments are, and you're going to put this on top of it. And when the world community is saying, get your fiscal house in order, it makes no sense.
I don't think we can overstate what you just said. Not only is the federal government looking at the largest deficit that we've ever seen by 3 times in the history of our country, just this past year, $1.3 trillion. But every state is having the same problem, and that's trickling down. In Georgia, for example, we have one county in our state that has run into these education reductions, Senator Alexander, that you're talking about, that universities all across the country are facing. That one school system reduced the days that their children are going to school from 5 days to 4 days, just to save the cost of buses running and other heating bills and whatnot for that extra day. That's not what we need to be doing as Americans. We need to figure out a way to struggle through this, but instead of struggling through it, what we're doing is now, in the toughest times that we've ever seen, as Senator Brownback just said, we're adding this huge, massive debt on top, and these huge taxes that are going to stifle the small business community on top of the debt that we have seen created in this country just in the past 12 months.
I've got a question I'd like to ask any of the senators to comment on if they would. Someone asked me yesterday, well, where is all this opposition to these health care bills coming from? Because we've seen the Gallup poll, the Pew poll. Now, these aren't Republican polls. These are well-respected polls of the country showing that independent voters by 2 to 1 say we don't want this. And all of us know anecdotally, I've been in and out of politics for many years. I've never had as many people stop me on the street, in the airport, wherever I am, and say, please don't do this. Someone asked me yesterday, why is there that much opposition? And my answer was this, and this is what I'd appreciate your comment on. My answer was, because this is not just about health care. This is, as President Obama said one time, a proxy for a national debate about the role of government in Washington in everyday American life. So this is about the stimulus package. This is about the Washington takeover of car companies. This is about the growing debt. This is about the takeover of student loans. This is about every Washington takeover, every increase in debt. That's what this whole debate is about, and I think that's why we're seeing such intensity of opposition. I wonder if you have any reflection on that.
I certainly think it is. You know, and what I'm observing too is people are coming up to me in large numbers and very passionately, is they are both mad and scared. They are mad about this taking place, and they're scared it's going to actually happen to them. And they feel like how can this happen to them in this country? And they look at that huge debt, and they look at our president over in China talking as if he's going to see the banker, and they don't like it. This isn't their country the way they want it to be. They want a country to be fiscally sound instead of going to beg hat in hand to the banker in a foreign country. And then you're going to add another big entitlement on top of that when you don't have it. And don't ask me, the taxpayer, for more money, because I don't have it. And they're mad and they're scared about this, and it's very disconcerting for people across the country.
I agree with Senator Brownback, and I guess I could sum it up in four phrases. Less access. Seniors fear because of the cuts in Medicare they'll have less access and less choice. Higher cost because of the bending of the way in which they calculate premiums and the added taxes going. Everybody knows that's going to be a higher cost. The great fear of rationing, which is a component part of almost every plan to get from where we are to where they want to take us. And then lastly, I hear an awful lot from young people who are considering a medical career, either in research or in actually applied medicine. They fear that medicine's not going to be the practice in this country in the future that it's been in the past. And if that's true, and if they leave and go to other fields, then we have less innovation, less research, and less development, and in the end, less quality health care for the American people.
And, you know, these are not people who are on the extreme right or the extreme left that are really bombarding us with phone calls, emails, and letters, or as all of us get on airplanes, as I did on Monday. I had people coming up to me as I walked through the airport, as I was on the airplane, as I got off the airplane, saying, please stop this thing. Don't pass this foolish bill that y'all are talking about up there now. It's amazing the type of folks that will come up and say that. And I got two quick anecdotes that I would like to read here. One is a letter that I got from a doctor, and it reads as follows. Dear Senator, I'm a vascular surgeon in Rome, Georgia. With a patient population that is 70% Medicare, I'm deeply concerned about the proposed Medicare cuts. After 8 years of college and medical school and 7 years of training, I have accumulated a large debt in loans and interest. Plus, there's the huge administrative burden of a large Medicare population in my practice. I don't know how I and other physicians are going to be able to afford to continue to see Medicare patients if these cuts go through. As it stands now, I'm paid only 23 cents on every dollar charged. I would appreciate your help in staving off these cuts. The other one is an email I got in the last few days from a good friend of Senator Isaacson and mine's. A guy named Bob Lovin is funeral director down in Nashville, Georgia, very close to my hometown. And this is what his email said. He said a lady walked into the funeral home and gave him a letter from the Veterans Administration. The letter stated that they, the VA, owes her $307 on her husband's death benefits. My friend pulled out her husband's file, and it showed that he had buried her husband 10 years ago. And his comment to me is, and we trust the government to run health care? I mean, that's how ridiculous it's gotten in the minds of people all across this country that are calling and writing every one of our offices, and certainly the offices of every one of the members of this body, because they don't understand why we are mortgaging and sacrificing our children's future, why, as Senator Brownback says, when the president goes to China to see our banker, which China owns almost $1 trillion worth of debt, the Chinese premier asked the president about the health care bill because he's concerned about the way we're spending money over here. I can never remember any foreign leader ever asking the president of our country about anything to do with the financial condition, particularly a program like this that would affect our financial condition.
We're down to about 2 minutes. Senator Brownback.
Well, I was just going to say, not only ask us, but then we got lectured. Our president got lectured by the Chinese regulator about our financial system. This is unbelievable, and this exacerbates it if we pass this bill.
I want to thank Senator Brownback and Chambliss and Isaacson for coming to the floor, and I think all four of us would want the American people to know above all that we have repeatedly said that instead of 2,000-page bills that raise taxes, raise premiums, cut Medicare, and transfer costs to states, we would rather identify the goal of reducing cost and go step by step toward that goal. And we have introduced specific legislation to take those steps, which could be bipartisan, such as the small business health plan that Senator Isaacson talked about, reducing junk lawsuits that Senator Chambliss talked about, competition across state lines. We have our step-by-step plan. We believe that the American people have lost confidence in Washington, and they would prefer that we go step by step in the right direction to reduce cost and re-earn their trust, rather than pass a 2,000-page bill that will bankrupt the country. Thank you, Mr. President. We yield the floor.